Good day everyone, my name is Daniel Luis Elvia Senior from BS and 2B, and together with my groupmates, Ms. Farah Rose Caucom, Ms. Janelle Rose Fantas, and Ms. Macy Nina Villa Flores, we will be discussing our topic, nursing roles and responsibilities. So to start off po, let's talk about nursing responsibilities. So as we all know, nurses have many responsibilities when it comes to the end-of-life care. End-of-life care is the care given to the people who are near the end of their life and have stopped the treatment in order to control or to cure their disease. And end-of-life care can range from having sensitive conversation with the individual about their care and preferences, recognizing any change in their condition, and offering compassion as well as support to the patient, pati na din po dun sa mga taong close sa kanila. During end-of-life care, nakikipag-interact po tayo sa patients in order to determine what their last wishes are as well as their preferences when it comes sa pag-end ng life nila. This is influenced by different factors such as their culture. Also, nursing responsibilities require a broad variety of skills and awareness of the values. Dahil po sa pag-aalaga sa mga taong malapit na mamayapa, ang focus po natin is to fulfill their wishes as well as to fulfill their family's wishes or preference for them and to have them maintain their dignity upon their death. So doon po sa may skills na tinutukoy kanina, ang example po nun is yung isang nurse kailangan po na merong siyang effective communication skills to do those things para ma-explain sa client or sa family nila and malaman po kung ano po yung preferences nila. And doon naman po sa values, sinabi po na kailangan aware tayo sa values in order for us to understand and identify possible culture influences and values that the client or their families would want to consider during the end-of-life care. And then, syempre, compassionate care has to be the forefront of all nursing care. But this is even more fundamental or important in the provision of care for dying people and those who are close to them. Dahil syempre, iba po ang compassion at ibang level po ng empathy ang kailangan natin para sa client at sa loved ones nila when it comes to giving care or support during sa mga panahon na to. So, during the end-of-life care, your responsibilities may include the following. So, first, speaking and listening. You will be speaking and listening to the client as well as to those who are close with them. So, tulad po na nababanggit kanina, we will have to effectively communicate with the client as well as their families or those people who are close with them to know their preferences when it comes to their end-of-life care. Then you will be observing, discussing, and recording. You will be observing, discussing, and recording any changes in the client's condition. Dahil kahit na po last days, last hours na nila, you will have to do our job as nurses to help them through the pain or alleviate the pain that they are experiencing, as well as to manage the symptoms na nagpapahirap pa sa kanila during their end of life. Ayan. So, next, you will need to offer compassion and support. You will be offering compassion, support to the client and to those who are close with them. So, when you are providing end-of-life care, you have to ensure that so number one, treat people compassionately. So, as a nurse, kailangan diba may compassion tayo sa mga patients natin sa ibang tao. But very important to during the end-of-life care dahil kailangan may paramdam natin sa kanila na we sympathize with them, nakikiramay tayo sa pinagdadaanan nila as well as dun sa paghihirap nila. And kailangan may pakita natin to through our deeds as well as our words na we are there for them to help them meet their needs during these times. Also, you have to ensure that you listen to people. Dito po, mahalaga na pakinggan natin yung hinanaing nila, yung mga habilin nila, as well as mga preferences nila, kung ano pa ba yung gusto nila during these times para mapakita natin na we sympathize with them. Ganon din po sa family para makita na maka-offer tayo ng support sa kanila. Syempre, dahil kailangan din nila yon during these times. Next, you have to ensure that you communicate clearly and sensitively. Syempre, dahil end of life na or near the end of life na isang person, ang air niyan is very heavy, emotional, and sensitive. So, kailangan careful po tayo sa mga sasabihin natin kasi diba, baka ma-offend sila, sumama pa yung loob nila. And we have to communicate clearly para malaman natin what else or what kind of service pa yung maaari nating maitulong sa kanila. You also have to ensure that you identify and meet the communication needs of each individual. So again, we have to effectively communicate with the patients and their loved ones to identify kung ano pa po kailangan nila ng tulong. So ayon po sa may nabasa ko online, we have to use simpler words when talking to them and explaining kung ano yung nangyayari or mangyayari dun sa may patients. So, kailangan din po dito na maging attentive tayo sa mga questions nila. As much as possible, masagot natin to and encourage natin sila na magtanong kung may hindi sila naiintindihan or may gusto po silang malaman para sa time na mag-pass away na yung client, magkaroon naman sila ng closure kahit papano.
Next is we need to acknowledge pain, distress, and take action. So nursing care includes not only disease management but also attention to physical comfort, the recognition that patients' well-being also comprises psychological, interpersonal, and spiritual dimensions. So as a nurse, dapat ay meron tayong knowledge and skills on how to manage pain and yung iba pang distressing symptoms ng mga pasyente natin na may serious or life-limiting illness. Then also, we need to work with our patients and yung family nila in palliative and end-of-life care decision making. The next is we need to recognize when someone may be entering the last few days and hours of life. So this is very important because once a provider fails to recognize that a patient is close to death may deprive patients of the opportunities that can occur at the end of life. Kasi kapag hindi natin nalaman or na-recognize na malapit na mamatay yung pasyente, parang nakikip natin sila sa mga responsibilities nila bago sila mamatay. Just like yung writing a will or addressing financial responsibilities. Then, another thing is, hindi ma-cherish ng family and nung patient yung last moments nila together. So, mabuti talaga na alam mo yung mangyayari as a nurse na nag-aalaga or nagbibigay ng care sa pasyente mo. Next one is we need to involve people in decisions about their care and respect their wishes. So, in some cases, nurses must also act as messengers or the middleman between the patients and their families. Kasi minsan yung patient natin is hindi komportable na sabihin sa family niya or loved ones niya kung ano yung nararamdaman niya. Kaya ay minsan tinatago na lang ng mga pasyente yung nararamdaman nila because they're unsure about sharing secrets. So, ang role natin as a nurse in providing end-of-life care is para matulungan natin yung mga ganitong pasyente para ma-express nila kung ano talaga yung nararamdaman nila and also to share secrets or final wishes that they want their loved ones to know. Next is we need to keep the person who is reaching the end of their life and those important to them up to date with any changes in condition. So, every single information na may kaugnayan sa kalagayan ng pasyente natin is dapat natin nasabihin sa kanila. And that is because they have the right to know everything and it can help them to be prepared to the possible things or scenarios that can happen. Next is document a summary of conversations and decisions. So documentation is important because it is required to establish how information may be adequately recorded, revised, and transferred across services. So, nakakatulong to para ma-ensure na yung patient's preferences in relation sa end-of-life care and place of death are as far as possible ay achieved. Just remember that caring for someone who's dying can be emotionally demanding. So, importante na aware ka sa nararamdaman mo. I mean, it's fine to show how you feel but try to remain professional as possible. Then, seek further advice if needed. And remember to look after yourself and your colleagues and also seek support if you need it. Ethical decision-making process refers to the process of evaluating and choosing among alternatives in a manner consistent with ethical principles. So, in ethical decision-making, necessary na ma-perceive and ma-eliminate yung mga unethical options then select the best ethical alternative. Dapat is ma-address yung conflict or yung uncertainty regarding sa competing values tulad ng personal, organizational, professional, and societal values because people's own set of ethics and morals influence their actions and decision making. So in healthcare, ethics allows nurses and other professionals to identify moral dilemmas na Nagpupush sa kanila na ma-apply yung good judgment sa decisions nila.
Provider, may mga bagay or may mga kailangan tayong dapat i-consider when we are making ethical decision. Number one, health provider and physician have to consider patient's perspective and preferences. Siyempre, kailangan natin consider ang ating pasyente at ang kanyang pamilya para malaman natin kung ano ba ang gusto nila at ayaw sa pagbibigay natin ng treatment, kasi if hindi pala gusto ng patient yung gagawin or ginagawa natin, magiging ineffective siya since hindi makikipag-participate ang ating pasyente sa atin. Also, through this ay may isasang-alang-alang natin kung ano ang gusto at ang makakabuti sa ating pasyente. Next one, physicians have to judge the situation and provide appropriate prognosis. Kailangan mapag-aralan or pag-aralan ng mabuti yung situation or case ng patient para malaman kung ano ba ang mga pwedeng gawin upang gumaling ang pasyente, at the same time masabi sa pasyente yung mga kailangan and yung mga alternative way para siya ay gumaling, and by telling what are the different treatment ay makakapili siya on his or free will kung ano ba yung gusto niya na i-undergo. Physician has to provide the information about the treatment, especially in case of futile treatment, to avoid any undue harm to the patient. As one of the rights of the patient, kailangan natin sabihin sa pasyente yung mga proper treatment and mga procedure na kailangan niya i-undergo, kasi ang pasyente ang magdi-decide nito, and para makapag-participate na rin siya sa lahat ng gagawin sa kanya. Also, kailangan din niyang malaman kung ang treatment ay futile na. Ang futile treatment ay kung saan hindi na gumagana sa pasyente yung mga treatment na ibinibigay sa kanya. Also, through giving information ay magiging aware ang family ng patient kung ano na ba ang sitwasyon ng patient and the patient itself. And lastly, healthcare provider also have to consider the aspect of equitable and distributive justice. Basically, pumapasok rito yung life and death situation wherein we overuse the different medical resources as we sustain the life of the patient, and nagkakos siya ng equity since we tend to give special treatment like we used to give expensive treatment pero alam naman natin na ineffective na siya. So as the healthcare provider, kailangan natin i-consider na when we are giving care or treatment, fair siya sa lahat ng pasyente regardless of economic status, and fair din siya towards to the patient na binibigyan natin ng care.
Requirements in the process of making ethical decisions. The first one is commitment. Commitment is the desire to do the right thing regardless of the cost. So, syempre, if may isang bagay ka na gagawin, mahalaga na committed ka, na parang gusto mo talaga yung ginagawa mo to keep you motivated since this helps sa pag-aalaga ng patient. For example, hindi ka naman talaga committed na maging nurse or tumulong or mag-alaga. Then, may patient ka na need ng gamot. So, possible na hindi mo ma-feel yung urgency nun, na hindi mo maiisip na kailangan mo na agad ibigay. So, nag-decide ka na tinatamad ka pa or maya-maya na lang ng konti. E di ang mangyayari, para maapektuhan pa rin yung health ng patient mo nun. Next is consciousness. It is the awareness to act consistently and apply moral convictions to daily behavior. As a health worker, it is important to understand na may mga tough decisions talaga na need gawin since involved nga yung buhay ng isang tao. So, dapat constantly aware ka sa mga nangyayari sa paligid mo kasi makakatulong yon sa pag may need kang gawin na decision. And dapat aware ka rin or alam mo na mahalaga yung bawat action na gagawin mo. Kasi if hindi ka aware sa kung ano yung nangyayari, kung alin yung tama and mali, wala kang magiging basis para malaman kung alin yung option or choice na mas makakabuti para sa patient. Last is competency. Competency is the ability to collect and evaluate information, develop alternatives, and foresee potential consequences and risks. In general, competency is the ability to do something efficiently. And yun nga, it is a must na ine-ensure na effective or may magandang kalalabasan or purpose talaga yung mga actions na ginagawa. Connected sa isang requirement, pwede kasing gumawa ka ng mga action na kung ano-ano lang since hindi ka nga aware kung para saan naman yun. Then, wala naman palang effect or hindi naman pala ikaw nakatulong dun sa patient. So, dapat effective yung isasagawa kasama na rito yung mga tamang ways sa kung paano mag-collect and evaluate ng information, yung paggawa ng alternatives since 'di ba sabi dun sa NCP, unique yung bawat isa. So hindi naman basta applicable yung particular na care dun sa isang patient is applicable na rin sa another patient. And of course, dapat alam rin yung consequences and risks para ma-prevent yon na mangyari. Good decisions are both ethical and effective. Ethical decisions generate and sustain trust, demonstrate respect, responsibility, fairness, and caring, and are consistent with good citizenship. So, ayan, good decisions should be ethical. This means na i-apply natin yung ethical principles and nakafocus dapat na ma-achieve yung mas nakakabote para dun sa patient. This can be done by showing them na pwede kang pagkatiwalaan, nire-respect mo sila regardless of their status, gender, etc. ganon, and by treating them equally, while also focusing sa priorities at the same time. These behaviors provide a foundation for making better decisions by setting the ground rules for our behavior. Ayun, if i-apply mo nga yung ethical principles and aware ka sa kung ano yung main goal and kung ano talaga yung mas makakabote sa patient, then it can lead into making better decisions. Effective decisions. Decisions are effective if they accomplish what we want to accomplish and if they advance our purposes. A choice that produces unintended and undesirable results is ineffective. Ayun, a decision is considered good if nakatulong or effective. Kasi if hindi nga naman nakatulong or walang nagawa, hindi nakabote dun sa patient, edi it's considered as ineffective. For example, meron kang unconscious na patient and aware ka na unconscious since galing sa surgery, ganon. Tapos, nun mo pa napagdesisyonan na itanong siya about something important or nun mo naisip na i-inform siya sa kung ano yung pwede niyang gawin para ma-ease yung pain, edi ano yung nagawa mo, diba? If hindi mo man lang hinintay na pag-conscious na yung pasyente or sa family member mo na lang sabihin, hindi ka naman naiintindihan ng patient since unconscious nga. So, wala ring naging effect. The key to making effective decisions is to think about choices in terms of their ability to accomplish our most important goals. In decision-making, if you were to choose, piliin raw yung option na may parang pinakakayahan or yung may most potential na ma-achieve yung most important goal or yung main goal. And this means na we have to understand the difference between intermediate and short-term goals and longer-range goals.